Hi Bob, how are you?
Hello, Dr. Lee. How you doing?
Yeah, I saw you both knee, and a few months ago, you did one knee, which is
This one
this
here.
one,
Yeah.
and now, when did you have this done?
Yeah. Well, this one, my recovery is about 9 months. This one here, my recovery is just 3 months and a week.
It's only 3 months. So if I take a look at both knee, so this knee is still a little bit swollen, and the temperature is almost the same. That means the inflammation is going down. So you finish your PT. Remember, when before you go surgery to replace this knee, we had a bunch of acupuncture treatment.
Mm-hmm.
And then, what's the motion range, and do you still have the pain there?
I have 126 degrees on this knee, and it's mostly skin stretching. The pain I get is not necessarily from muscular, it's more I'm stretching the skin.
Okay.
This one here, I'm up to 130 already.
Okay, good. So this progress even more than that. But let me ask you one important question. Do you still have pain in both knee if you go up and down stairs?
Very moderate in this one, maybe a 2 if I'm
Okay.
going to put it on a pain level, maybe a 4 or so on this
Okay.
one. The doctor, my surgeon, that was a very good surgeon from Florida.
What's his name?
His name is Dr. Messier.
Messier.
And he's
Okay.
done thousands of these. He's
Okay.
very, very well known. And he told me, generally speaking, it takes a year.
Uh-huh.
It takes a year for the lack of pain, but he says it's important to keep your rotation and your stretching because you could lose that if you don't continue it.
So you have a very good recovery. Now I want to ask you one important question. After the surgery, your doctor really didn't encourage you to use the ice. Is that true?
That's correct.
Yeah.
He said something about it hinders the circulation, and there's another machine that some orthopedic doctors use, and that's a machine that does the stretching. And his feeling is, I want my patients to be able to do the stretching on their own and not have a machine do it, because they're exercising more muscle than having a machine do what they should be able to do themselves.
Yes, so from this doctor, I learned two things. One is, even there is a swelling, you don't want to use too much ice because you constrict the blood vessel and you make muscle tight. So when you move, it's very easy to torn the muscle or ligaments. You got a joint replaced, but you still need muscle and ligaments to support this knee.
Sure.
So that's number one. And number two is, he's absolutely 100% right, because when you do your exercise comparing with the machine, you have your brain control that, and how you move this knee. If there is a pain, your brain sense that, you adjust that. When you use the machine, you don't have this feedback, right?
Right.
So this episode, we want to emphasize, before you go into your knee replacement surgery, like Bob said, you need to reduce the inflammation and also improve the circulation with the acupuncture, with the exercise, pool exercise, so that you can recover faster. You can recover as well as Bob. Thank you.